It seems that Canada is not taking as strong measures as some other countries in regards to the coronavirus. Why is that? And are you confident that all the provinces and territories have the equipment, supplies, hospital beds, etc., in the event that there is a widespread outbreak here in Canada?
Canada has been following the recommendations of the WHO and indeed leading around the WHO tables on what the best paths are to take. There are a number of countries that have made different choices, but we are confident that what we have done in Canada, what we continue to do in Canada, is right for Canada. And I think the numbers so far bear it out, but we, of course, will continue to monitor very, very closely how we are responding here in Canada, what new and next steps we need to be taking. We'll be working with our international partners. We have been working extremely closely with our provincial counterparts, with provincial governments, in order to make sure that Canadians are being kept safe from coast to coast to coast. We will continue to do everything necessary to keep Canadians safe. Okay.
I can emphasize that Canada has been following since the very beginning the recommendations of the World Health Organization and even participating in the discussions of the WHO on what are the best ways to keep people across the world safe. We will continue to follow attentively, day by day, the needs and the best ways to act, but we can reassure people that the government, federal and the provincial governments are working in very close collaboration to ensure that everything that needs to be done to ensure the safety of Canadians is being done.
Heidi Petrachik with CTV. Welcome to Halifax. Welcome back, I should say. In that same vein, your government has said that provinces would be responsible for managing any coronavirus cases, but would you consider some kind of plan where you could help transfer healthcare funds to provinces to help them with that extra burden on the healthcare system?
We recognize that the coronavirus represents a particular and very real challenge to healthcare systems across the country and indeed around the world. We have full confidence that provincial health authorities are going to be able to deliver healthcare services as they are constitutionally mandated to do. But we will, of course, look to ensure that there are the resources necessary to keep Canadians safe. This is a moment of real challenge for Canadians, indeed for the world, and we're all going to be working together to make sure that the impacts are minimized on Canadians.
Can you repeat in French, please? And adding, what about the impact? How will you help businesses that are affected? We recognize just to what extent the health authorities provincially have the capacity to manage their health systems. We have full faith in them, but we also recognize that they might need a bit more resources, and the federal government will always be there to see how we can help even more to help Canadians safe. With regard to our concerns on the economic impact, we are working closely on that. Our finance minister just had a conversation with his counterparts in the G7 and G20 to see how we can respond to these issues, and we'll continue to ensure that the economy doesn't slow too much. Obviously, it's a global context that we don't have full control over, but we know that it's important to support business and industry in Canada that will be facing challenges.
The very real economic impacts of the coronavirus globally. That's why our finance minister has been in close touch with his counterparts, both of the G7 and the G20 finance ministers. We are coordinating globally to try and make sure that there is a lesser impact on the global economy. We also recognize that there will be impacts on Canadian businesses, on Canadian entrepreneurs, and we will always look for ways to minimize that impact and perhaps give help where help is needed. Merci beaucoup tout le monde. Thank you all.
Thank you very much, everyone.